no one else had it, and I knew it, and I'm just wondering, it seems like a lot of the severe symptoms, they said it was a really mild case of mono, but it seems like a lot of the severe fatigue, a lot of the symptoms and stuff I experienced is just, I don't know, just a thought, like I wonder if that's one that people are misdiagnosed with, or is there a foolproof test?
Actually, yes. Whenever we get the Lyme disease organism and the other organisms that come with it from the tick bite, it can damage our immune systems to a point where we actually have a reactivation of viruses that live within our bodies. So one of those that almost everybody here has already picked up in their lifetime, usually by the first person you kiss as a teenager, is mono. And so that mono organism can actually come back and be a player in all of these infections at that time. We also see people who end up getting shingles when they have Lyme disease, when they're very affected by Lyme disease. And that is the chickenpox virus that comes back to visit you. And all of these things can happen. And so, yes, you can have all those symptoms, but it may be Lyme disease that is actually allowing those organisms to come back and haunt you again.
Okay. So is there an actual blood test for mono that says?
Yes, there is a test for mono that says that you have a reactivated virus, okay, or that you got a new virus. But in most cases, if you were a teenager at that time, that was probably a new virus. But if it was later on, most of us already have picked up that virus early in our life.
I was a teenager. So.
Yeah, it's probably a new mono then. Not necessarily an organism that comes out when you have Lyme disease. Here are some more symptoms. It's not over. Tremor, twitching, poor balance, skin hypersensitivity, numbness, mood swings, disturbed sleep, problems with sight and hearing, gastritis, colitis, unexplained weight changes, either up or down, Bell's palsy, and other nerve roots affected. And the main ones I'm going to talk about are vulvar pain and radiculitis. Radiculitis is the one that I had, which is all of these radicula that come off the spinal canal, and all of those are affected, and I had extreme pain, and you could trace every one of those nerves coming off my spine, and that's called radiculitis. The other is vulvar pain, and I want to talk to you a little bit about that because I went to a Lyme conference a number of years ago, and the very first speaker was a gynecologist. And I went, what is a gynecologist doing at a Lyme conference? I couldn't figure that one out. And she said that she was seeing a lot of women coming in with vulvar pain, which means that it's in the perineal area, and they were having difficulty even wearing panties, having sex, tampons, all of that stuff was very painful for them. And she tested them, and 90% of them had Lyme disease. So it can affect any nerve root. The main nerve root that usually is affected is along the face, and we call that Bell's palsy. The sight and hearing problems, usually tinnitus, which is ringing in the ears, can occur. And I have one person in my support group who has hyperacusis, which is everything is amplified. So he has to wear earphones over his ears to block out everything. Even the noise, road noise from the tires on his car, and people talking. Everybody's talking too loud, and it just makes his head just ache. So it can happen in so many different ways. This is Bell's palsy, and both of these people are smiling. The one on the left has a smile on the right-hand side of his face, but the left-hand side of the face is actually paralyzed. And so it looks like a sneer, but it's actually paralyzed on that side. The one on the right-hand side has just the opposite. Okay, so it can happen on either side of the face. If anybody has Bell's palsy and maybe has some of the other sprinkling of symptoms, this is Lyme disease. This is Lyme disease. Everybody who has Bell's palsy, practically everyone out there, can be tested and it is positive for Lyme disease. Okay, it is a great imitator, like you said. So if you take all of those symptoms that you have just of the Lyme disease, not even talking about the other co-infections, it looks like Alzheimer's. It looks like Parkinson's. It looks like multiple sclerosis, which is one of my diagnoses. It looks like Lou Gehrig's disease, or ALS. And it looks like autism. We're having lots of children now with the autism spectrum disorder in Oregon. I think there was like 1 in 6 boys in Oregon. I mean, it's a huge number in Oregon that has autism. And I'm wondering, you know, if you test these kids, do they really have Lyme disease? And if they do, they can be treated for Lyme disease and their autism clears up if you catch it early. Chronic fatigue syndrome, fibromyalgia, those were my 2 diagnoses. I know that was Deb's diagnosis for many years. And I'm thinking that almost everybody who has those diagnoses probably has Lyme disease. And there's over 300 other diseases as well around the world. And the reason for this is because the symptoms are so widespread throughout the body. You go to a doctor, let's say you go to a rheumatologist because you just have a knee that's swollen up. Well, the rheumatologist looks at the knee and doesn't look at the rest of the symptoms that you have that might be neurological. You go to a neurologist and you say, well, I've got these headaches and I've got like twitching that's going on. And so they don't look at the knee, they just look at your brain symptoms and your twitching and that sort of thing. And so you get these labels from different doctors that do not put the whole picture together. And that whole picture is put together by what we call a Lyme literate doctor. And I would like to tell you a little bit about syphilis, because years ago when I first got into nursing, I remember going into the library and there was this book that thick on syphilis. It was a huge, thick book. And the opening comment was, to know syphilis is to know all of medicine. Well, I think that's true for Lyme disease and co-infections. You have to look at the big picture. You have to look at everything that is causing symptoms in a patient. Okay, can I get tested for Lyme disease? The types of tests that are out there are direct visualization, which is they can take a culture or they can take a biopsy and they can actually identify the organism in that blood or in that spinal fluid or in the synovial fluid out of your joint. And they can actually culture it. It's been difficult to culture Lyme disease up until now, but there is a laboratory in Pennsylvania that has perfected the auger plate and perfected how this organism operates, and they're actually getting very high numbers of culture positives. My blood is sitting in their incubator, so if it comes back positive after 10 years, 12 years actually, of antibiotics, I'm not sure what I'm going to do about that, if it's still positive and still in my body. But I think it's going to be positive. One thing I know I'm going to do is I'm going to send it to the Public Health Department of Oregon and see what they do about it. The next tests are antibody tests, and these are indirect. They're looking at your immune system to see if your immune system is making antibodies to that organism. And there's different ways of doing that. The indirect fluorescent antibody, or the IFA, the enzyme-linked immunosorbent assay, the ELISA, and the Western blot. The ELISA is about 50% effective at picking up Lyme disease. And so it's no better than a coin toss. And that is the very first test that the CDC says you must have done. And only if that is positive do you go to the next level, which is the Western blot. Yes?
Okay, what if you turned, they said